Hello, I'm Professor Mark Creamer, Director of the Australian Centre for Posttraumatic Mental Health at the University of Melbourne. At some stage in their lives, most people will experience one or more very frightening or traumatic events, and it may be that this has happened to you or someone you love. Thankfully, most will recover with the support of family members and friends, but some will go on to develop more serious problems like post-traumatic stress disorder or PTSD. A set of guidelines has recently been released that outline the best approach to help people recover from trauma. These guidelines were developed in consultation with experts and people affected by trauma. After watching this DVD, we hope that you'll have a better idea of why you or someone you know may be feeling or reacting as they are after experiencing a trauma. We hope that you'll understand these problems better and have more information to help you find the best care.
Before we talk about reactions to trauma, let's first talk about what trauma is. There are two parts to how a traumatic event is defined. The first is about the event itself, and the second is about the person's reaction to the event. This is important because not everyone will be affected by the same event in the same way. For an event to be called traumatic, the person needs to have experienced or witnessed a situation that involved the threat of death or serious injury. And the person's reaction needs to have included feelings of intense fear, helplessness, or horror. Examples of events that may cause a traumatic response are accidents, assault, natural disaster, and war. It's important to say at the outset that it is normal to have strong emotional or physical reactions during or immediately after a traumatic event. Almost everyone who is exposed to trauma will experience this. As well as feelings of fear, helplessness, and horror, people can experience a range of emotions, including guilt, anger, and grief. In this next clip, we'll hear from John, who had a motor vehicle accident 7 days ago. Although he wasn't seriously injured, he thought he was going to die, and it was certainly traumatic for him. In fact, motor vehicle accidents are the most common cause of PTSD in Australia. John, can you tell me how things have been for you since the accident?
I just haven't been myself since the accident. I've been very irritable and moody. I'm still at work. I work as a mechanic. But I've been very snappy with my workmates, and I've started making mistakes. So far my boss hasn't said anything, and the others generally seem to be cutting me some slack because they know about the accident.
Okay. And how are things at home?
I'm grumpy at home. I don't want to talk to my wife about how I'm feeling and what happened because I don't want to upset her. She wants to talk about what happened, but I'm just not sure.
Okay. Are you sleeping okay?
My sleep is a bit of a problem. I've been waking up during the night and having bad dreams about the accident a few times in the last week.
Okay. Do you think much about the accident during the daytime?
I get very upset when I'm watching TV because there's so many shows, action movies and ads with car accidents in them. I find I've just been getting upset, so I haven't watched much TV in the last 3 to 4 days.
Right. Have there been any signs of improvement at all over the past few days?
I feel a bit better than what I did a couple of days after the accident. And the whiplash has also settled down a bit.
Okay.
I'm not driving yet. My wife has been driving me to work. I find it takes a lot of effort even to go as a passenger.
Right.
I'm pretty exhausted and stressed out by the time I get to work, and it's only a 15-minute drive.
Okay. Are you doing anything to look after yourself?
I walk after dinner.
Okay, good.
But I can't run as I usually would because of my neck.
Yeah.
I have a couple of beers when I get home from work just to calm me down a bit.
Following a traumatic event, there are a lot of different ways people react. While some may shut down emotionally and feel numb, others might show quite a lot of distress. Common reactions include many of those that John described, such as distress when thinking about what happened and nightmares. John also tried to push away thoughts and feelings about the accident and stayed away from anything that brought back the memories. He told us that he felt keyed up or on edge, which caused problems with concentration, sleep, and irritability. This kind of reaction is common in the first week or so following a traumatic event. And at this early stage, it's not necessarily a sign that the person is developing a mental health problem. In most cases, these symptoms will just settle down by themselves with time. But to help recovery during this time, it's a good idea to spend time with people who are supportive. Look after yourself with proper eating, sleeping, and exercise. Try to maintain your usual routines as far as physically possible. And do things that help you relax. Do things you enjoy. And talk about it if you feel like it. But don't feel that you need to talk about it at this stage if you don't want to. Things that can get in the way of recovery include using alcohol or drugs to cope, keeping yourself overly busy as a way of avoiding the memories or painful feelings, getting involved in stressful family or work situations, withdrawing from family and friends, stopping yourself doing things you enjoy, and taking risks. If problems do persist beyond the first week or two, we would encourage people to seek help. While most people recover after a traumatic event, some go on to develop mental health problems. The focus of this DVD is on PTSD, but it's important to acknowledge that it's not the only problem that can arise from trauma. Other common problems include feeling sad and depressed, as well as anxious and fearful for the safety of oneself or loved ones. Following some experiences, people can feel a sense of loss and grief. Unfortunately, some people use alcohol or other drugs as a way of coping, and this can become a problem in itself. And it's not uncommon for several of these problems to occur together. But back to PTSD. There are three main types of difficulty in PTSD. First, the person may be haunted by vivid memories of the event, often feeling as though they're reliving the experience. Second, they may find themselves being overly alert or wound up, as well as irritable and angry. Thirdly, because the memories are so distressing, they may try to avoid anything that reminds them of the event. In some cases, the person seems to shut down emotionally, becoming numb and withdrawn. These all impact on a person's ability to function in many ways.
Come and have a seat.
In this next segment, we'll hear from John 1 week later. So, John, it's been a week since we last met. How have things been for you over that time?
Not much has changed. My sleep is still a problem. I haven't been having the bad dreams as much, but I am still having them. I've been waking up pretty frightened and just saturated with sweat. I'm still finding I've been getting upset watching TV shows with accidents in them.
Sure. How have things been at work?
My concentration at work still isn't good enough. I'm making errors. Nothing too major, but I've noticed that my workmates have been looking over my work afterwards in a way that they didn't do before. I find I've been getting startled and just generally feeling pretty edgy.
Okay. Are you driving now?
My wife is driving me to work.
Okay.
I haven't tried sitting in the driver's seat yet. I just feel too nervous about it. My mates have been telling me that I should just put the accident behind me, but I just can't seem to get it out of my mind. I'm still having trouble talking to my wife about it.
Okay. Are you looking after yourself?
I'm still walking after work.
Okay, good.
Well, my wife and I went to the movies the other night. That relaxed me a bit. Well, we walked because it's only a 15-minute walk down the road. I've been having about 2 to 3 beers almost every night just to calm me down a bit.
John's problems don't seem to be reducing, and at this stage, getting help for his problem is important. We know that asking for help is a big step, and it can be difficult and frightening. John has already started this process, but for those who haven't yet asked for help, your GP is a good place to start. Your GP will most likely refer you to a mental health professional, like a psychologist, a psychiatrist, or a mental health social worker. Although psychological treatment is usually the most effective, it's not always available and it doesn't suit everyone. Medication can also be useful, either instead of or along with psychological treatment. You should be involved in making decisions about the care you receive every step of the way and be given enough information to participate fully in those decisions. Asking questions is important.
The key focus of treatment is to help the person confront the things they've come to fear and avoid. When the person starts relying on avoidance to cope, they've got no opportunity to develop skills that'll help them feel safe or comfortable when they're faced with reminders of the event. They don't give themselves the opportunity to come to terms with what happened, and the anxiety can spread into other areas of their lives. For example, Sarah was sexually assaulted by an ex-boyfriend who followed her after she left a party in the early hours of the morning. On the Monday after the incident, Sarah returned to work. At lunchtime, she left the office to go to the newsagent. She turned into a side street to take the shortcut that she'd always taken, and she started to feel anxious when she realised there was no one else in the street. She turned around and walked back onto the main road. As soon as she turned around, she felt immediate relief. Pretty soon she found herself avoiding going out at all during her lunch break. The anxiety just kept getting worse. She's now starting to get anxious at even the thought of going to work. What we see is that the anxiety spreads and the person's comfort zone shrinks. She sought help to develop skills to help her feel safe and comfortable.
Sarah, from what you've told me, it sounds like you might be experiencing something we call post-traumatic stress disorder, or PTSD. The most effective treatment for PTSD is what we call trauma-focused therapy. Would you be prepared to give it a try?
Well, I guess so. I'm willing to try anything that will help me to feel better. But what does it involve?
Well, the most important thing when getting help for PTSD is to target the memories or the events that are causing this stress. Treatments that help you to cope are helpful, but not as helpful as those that actually target the memories.
I'm not sure I could handle that. I can't bear to think about the rape, let alone talk about it.
It is difficult, but important to remember you'll be confronting the memory of the rape at your own pace, and importantly you'll be learning skills and strategies to help you manage the painful feelings before we deal with the memory.
If I do it, what exactly will happen in the sessions?
Well, trauma-focused treatment's got 3 main parts. The first part helps you to gradually face the memories. While we're doing that, you'll also be gradually facing situations and activities that you might be avoiding until they no longer upset you as much. And finally, you'll be exploring thoughts and beliefs about what happened that may be getting in the way of your recovery.
So how does the treatment work?
Traumatic events like the event that you've experienced can be so overwhelming that it's often very hard for the mind to make sense of it like we would for everyday events. Trauma-focused therapy is a way of working through the memory in a safe, gradual and supportive way. By digesting the memory in this way, we can store it then alongside other memories for everyday events. That's not to say that it won't be distressing to think about, but at least it won't be overwhelming. And when it feels okay to think about, then you won't spend so much time and emotional energy trying to avoid it, and you can get back to a normal life.
So how long does the treatment last?
Well, the part of treatment that we call trauma-focused lasts for between 8 and 12 sessions, although we can't say for sure. But importantly, we'd be spending some time helping you develop skills and strategies to deal with the painful feelings before we dealt with the memories. Would you be prepared to give it a try?
Okay, if it will help me.
Okay. Sarah asked a lot of good questions. We encourage you to ask questions of your practitioner. It's important to remember that it's never too late to seek help. Some people seek help many years after experiencing a traumatic event. Let's hear from another person, Steve. Steve's a policeman who experienced trauma in the line of duty.
I was incredibly nervous the first time I went to counselling and a bit angry. I was really doing it for my family. I just didn't think that talking about things would help. It took me a little while to get used to it. And the counsellor taught me how to relax when I got scared or angry. When we started talking about what had happened, it was really hard to start with, but it got easier as things went on. I talked a lot about questions that kept popping into my mind, like, how could this happen to me? Where was the rest of the crew when I needed them? Could I trust people in the future? It's not the sort of questions you feel comfortable talking to your family about, but it felt good to talk to someone about it. It's been a tough journey, but I know how to deal with my demons now. The thoughts, they come and go, but they don't stay too long. I just tell myself, don't be stupid, you can do this, get through it. When I look back, I realised that the treatment was just like getting back on a horse when you fall off. If you don't, you get more and more scared of the prospect, and you may never get back on. The event I went through was awful, and I never want to go through that again. But I realise now that remembering what happened is very different to going through it again. The more you think and talk about it in therapy, the easier it becomes. I still find it upsetting, but the memory of it now no longer terrifies me. If it does pop into my mind, I don't panic. I just get a little sad and then get on with whatever I was doing.
In research trials, trauma-focused psychological therapy has been found to be the most effective treatment for PTSD. But there are situations in which that kind of therapy may not be available, acceptable to the person being treated, or it may not be appropriate. For example, if a person is too depressed to benefit from trauma-focused therapy. Then we might consider the use of medication. Newer antidepressants are the most effective medication treatment for PTSD. They help reduce many of the symptoms of PTSD even if you're not depressed. Of course, they also treat depression symptoms that can occur at the same time as PTSD. There are different kinds of antidepressants. SSRI antidepressants work specifically on the brain chemical serotonin. They are amongst the newer antidepressants and are most commonly used. They should be the first medication option for PTSD. There are other types of newer antidepressants that work in different ways, and there are various older types of antidepressants that can also be effective but may cause more side effects. Sleep problems are commonly reported by those suffering PTSD and usually improve with psychological treatment or when antidepressant medications are used. Sometimes the more severe sleep problems need to be treated with a short course of medication. Sleeping tablets should only be used once other means of improving your sleep have been explored or on advice from your doctor. Even then, they are only a short-term solution. Sleep medication can be addictive if it's taken over a long period of time. I'd really encourage you to ask as many questions of your GP as you need to feel comfortable that the medication he or she is recommending is right for you.
How does this medication work? Does it have any side effects, and how long will they last for? How long will it take before I start to feel better? How long will I have to take it? What do I do if I forget to take my tablets? When it's time, how do I go about stopping the medication? What will happen when I stop taking it?
Answers will vary to some degree according to the different medications and the person's individual circumstances. The most important thing is that you feel you are getting the information you need to guide you in your decisions about your treatment. If you feel you are not getting the information you need, seek a second opinion. As with any other health condition, treatment for PTSD is not always straightforward. In the next section, we'll discuss some things that might get in the way of your recovery and how to deal with them.
Recovery from a traumatic experience will not necessarily follow a straight line. Most people find they have ups and downs, good days and bad days, although they can see improvements overall. Things like anniversary dates, news coverage of similar events, and going through a stressful time for other reasons can lead to a temporary increase in symptoms. The important thing is to be prepared for this and plan how you're going to manage any ups and downs with your health practitioner. You can prepare yourself mentally as well as in a practical way. For example, when you understand why you are going through a difficult patch, you can see it for what it is rather than worrying that you're going backwards. In a practical sense, you might decide to plan an enjoyable activity or ensure that you've got extra support on hand in case you need it. What we need to be more concerned about is if aspects of the treatment itself get in the way of your recovery. I'm talking about things like not getting enough information about your treatment, not feeling comfortable with your health practitioner. It takes time to develop trust in someone. You may need to allow for enough time to form a good relationship with your practitioner. However, if you continue to feel uncomfortable, it is important to discuss it with them or give yourself permission to change and look for the right practitioner. Staying motivated and on task during treatment can also be a challenge.
What does it involve?
Asking your practitioner about how to stay engaged or how to deal with setbacks is an important part of recovery.
Memory can still be distressing.
It's important that you take an active part in making sure that you get the help that you need. Don't just let things drift on if you don't think you're getting any better. These are the sorts of questions that you might want to ask.
My sleep, my nightmares, and the moods I'm having, they aren't improving. What else can we do? I had expected to feel better. Can we talk about my progress? Do you think I need more time, or do I need to try something else? Can we talk about other treatments? What else is there available? Can you give me strategies to help me manage my sleep and my panic attacks better?
We'd like to say a few words to family members. PTSD can impact on the whole family, and it is important that your needs and perspectives are taken into account throughout treatment. It can be very difficult to watch someone you care about struggle with a distress caused by a traumatic event. You may find yourself constantly worrying about their well-being and feel helpless when confronted with their emotions. People with PTSD can seem disinterested or distant, as they try not to think or feel in order to block out painful memories. So you may feel shut out. They may stop participating in family life, ignore your offers of help, or become irritable. It is important to remember that these behaviors are part of the problem. They are not about you. Sometimes you may be left wondering what's the best thing to do, both to help your loved one and to help yourself. Everyone's situation is different, and you should get specific advice from your family doctor. But here are a few pointers. As far as possible, and with the permission of the person who's been affected by trauma, be involved in their assessment and treatment.
And I guess it's important during this process that we try and keep the stress that John's exposed to a minimum.
The more you understand about what is going on, the more you're able to provide support. Also, listen and show that you care, but remember that you're not the therapist. Listening and reassuring your loved one of your support is all you need to do. If you cannot bear to hear the details of what happened, you don't need to. That is what the therapist will do. Even though you might feel like saying it, it's not helpful to tell someone to just get over it. If it was that easy, they would. Expect ups and downs. Recovery is rarely a straight path. When your loved one is going through a rough patch, acknowledge it for what it is and offer extra support. And perhaps most importantly of all, look after yourself. Supporting someone can take a toll. Spend time with your friends and do regular exercise. So what's changed over the last week? What is he doing differently? You may also seek support from a counsellor or a group for families or carers if you think that would be helpful.
And it's not good around the kids when you're yelling all the time. It just stresses them out as well as me, as well as Stephen.
We sat down together with the counsellor and we both discussed how we were feeling. And I have to say that really helped, because it meant that he had to think about me and my needs as well as his own. And I don't think he'd ever felt that before. It's not that he doesn't care, it's just that he was so wound up in his own world, he wasn't thinking clearly. Anyway, since then, we've agreed on how to divvy up the responsibilities, like the housework, and how to manage the kids, and even that sign he gives me when he needs his own space. We've even got friends we can rely on now. Until I had the counselling session, I didn't think to ask them, but they are so grateful that we did, because they really wanted to support us, but they didn't know how to go about it. All I need to know is that there's someone on the end of the line.
I hope this DVD has helped you to understand more about what PTSD is and what treatment involves. If you need help, we encourage you to start by speaking to your local GP. More information about the guidelines and about coping with trauma is available from our website.